RPD, the major connector, minor connector, direct and indirect retainers, and the denture bases. So in the major connector, today we will be seeing regarding the maxillary major connector. So I told you what is a major connector. It's a part of the RPD which joins the components on one side of the arch to the other side. So this is a, when we can consider the bilateral arches, so this major connector is going to connect the components on one side to the other side. And all the other parts are directly attached to this major connector. What are the main requisites for a major connector? The first is the rigidity. So that it allows the stresses applied on any portion of the partial denture to be distributed over the entire supporting area. So now if you see, this is the major connector. Major connector is going to connect all the other components bilaterally. So any force which is applied, for suppose take a force which is applied over this premolar. Through this premolar, it is going to be transferred to the other side of the arch also, so that there is equal distribution all over the supporting structures. So on the other components of the RPD, such as the retentive clasps, the occlusal wrist, these are the occlusal wrist, retentive clasp, this is the retentive clasp, and this is the stabilizing clasp. And the indirect retainers can be effective only if this major connector is going to be rigid. If it is flexible, all the other parts are going to act in an adverse effect over the abutments. And then the cross arch stabilization. So cross arch stabilization means you're going to take the support from both the sides of the arch. If there is any less amount of support in one arch, it is going to flex and the RPD is going to move. Thereby, there are some adverse effects on the adjacent abutments. A rigid major connector will limit the movement by acting as a counteracting lever. The more important in situations associated with high potential for greater processes movement. So we are supposed to stabilize the processes. There should not be any movement of the processes during function. That's why we require sufficient amount of retention and stabilization from the other areas of the arch. So in this class 1 condition, we are going to take some amount of support from the adjacent abutments by use of direct retainers, and also we are supposed to use an indirect retainer either in the canine area or mesial to the premolar, in the mesial marginal ridge. Or in some conditions, we are also supposed to take the indirect retention from the anterior incisors based upon the condition of the incisal teeth. Then the protection of the soft tissue, it should avoid impingement of the free gingival margin and should never terminate on the marginal gingival tissues. And also bone and soft tissue prominences should be avoided. So now if you consider this, see, it has to be far away from the adjacent structures. And also this anterior part should not be covering over the rugae area. As far as possible, we are supposed to see that it is not going to encroach over to the rugae area. And also there should be sufficient amount of